Okay, so hi everybody. My name is Sabahat Ahmed. I'm from Ashmir Life Coaching Practice. I'm based in Dubai. I'm a life coach, NLP practitioner, and a clinical hypnotherapist. And I'm joined today by Bobby Jo Bottomley from London, who is my trainer, and she is an expert hypnotherapist. And I'll let Bobby speak for herself in a minute, but I'm joined by her to talk about the myths and misconceptions of hypnotherapy, and we'll try and address some questions that people have sent across. So Bobby, thank you so much for joining me in this session. And I'll let you just, introduce yourself.
Thank you. My pleasure. Thank you for inviting me. So I'm Bobby Jo Bottomley. I'm a hypnotherapist, NLP practitioner and life coach. I'm actually based in Hampshire, and I'm the founder of the Hampshire Hypnotherapy Clinic, and I'm also privileged enough to be a trainer, so it was wonderful to be one of Sabahat's trainers. And I do some other bits. I'm a course author as well, so absolutely love my job. And thank you for inviting me again.
No, thank you, Bobby, for being here. And I'm sure that we'll be able to share a lot of insights and clear up some misconceptions that people have about hypnosis and hypnotherapy as a general rule. So tell us what is hypnotherapy and what is the state of hypnosis? I hear so many things, and before I actually trained with you, I always used to think it was the same as we see in the movies, that somebody shows you a pendulum and it moves and you just go into this trance and you can say anything and everything that comes to you and people find out secrets about you. Is that the case?
If only. No, that's not the case. But really, really common misconceptions. So it's really valuable that you said that what you kind of thought it was. So it's just a really, really relaxed state.
Oops, sorry, I've lost your audio there. Sorry, I've just lost your audio. Yeah.
Have you got me? Sorry.
Got it back. Got it back. Perfect.
Sorry about that.
No problem.
So yes, if you've got a staircase with wide awake being at the top and fast asleep being at the bottom, hypnosis is kind of that bit in between.
Mm-hmm.
So you actually take someone down the different brainwave states. So at the top, we're in beta. And as generally, it takes the average person about 12 minutes to relax. So as you can do kind of what we call an induction. So you induce hypnosis in someone. And when you do that, you're taking them from beta into alpha. And then we also use what we call deepeners, which you can use to deepen someone's level of trance. And generally, we try and get a client into kind of theta brainwave state. So it's just a really relaxed state where you can kind of bypass that sort of conscious, critical kind of mind and talk straight to the subconscious. And the subconscious is a bit like, I kind of describe it a bit like a 3-year-old child. It believes anything we tell it.
Yeah.
So if we give the subconscious mind lots of positive suggestions, it will start to believe and accept those, and we change things at that level.
Absolutely. And I remember the first time I was hypnotized in the practitioners program. I thought I could never be hypnotized because I have this hyperactive, logical mind, as I thought I did, but probably I didn't. Because the moment my fellow coach started practicing or hypnotizing, I just passed out completely. And I woke up when she said, "No, I'm going to wake you up." But it was amazing that the problem that I was working on, I was able to actually act on it even afterwards, even though I didn't hear anything during that state of hypnosis. So is that normal?
Absolutely. It's really, so people, there are different levels of susceptibility, we call it in our field. So there's about 20% of the population kind of up here, they're what we call somnambulists. So they go into a very deep level of trance, and actually they won't remember anything afterwards, which is really funny because you can do some really intensive work and they just don't remember it. But it's very, very effective for those people. Then there's about 60% of the population that it's really effective for. They will remember afterwards. And then there's about 20% that it's not so effective for. But those tend to be the people who perhaps are cynical or don't believe. But sometimes it's very common for people to be in hypnosis and kind of think, am I actually in hypnosis? It's common for the conscious mind to kick in sometimes. All very usual. And there are actually some tests you can do with people in hypnosis that kind of reassure them that they are in hypnosis. But it does it. They're rapid transformational change therapies because they're called that because we're addressing things at a subconscious level. We create change very quickly with the people.
So what kind of tests can people do? Or can
so what kind of what, sorry?
What kind of tests can be done for people to understand that they can be hypnotized, or hypnosis can work for them?
So there are a couple of, they're called susceptibility tests. There's a couple that I tend to use. One you can use quite consciously, where it's called a finger test, where you get people to copy you, hold up the fingers, and you're saying to people that they have magnets that are drawing their fingers closer together. You're using hypnotic language all the time, so things like notice, you're repeating things more and more. So there is certain hypnotic language which the subconscious mind loves. I tend to use one that's called an arm assurance procedure. So when I've got someone in hypnosis, and I always check with people that they're happy for me to raise their arms or touch their hands if I'm going to do this procedure, I will come over and raise their arm, and I tell them that that arm is becoming very light, and in fact it's so light that they could leave it comfortably there in the air all day if they wanted to. And then I raise their other arm and I tell them that that arm is becoming very heavy. I kind of pretend, get them to imagine that I'm putting a bucket in that hand and I'm filling the bucket with sand. And that arm does start to become heavy and it comes down. So they've got this arm up and this arm down. And then I say, actually, you knew that there was no, there were no cushions. I've got them to imagine cushions under this arm, no cushions there. You knew there was no bucket and no sand, but you took my suggestions and you allowed this arm to come down and you allowed this arm to stay in the air. And therefore you now know that you're in hypnosis because you listened to my suggestions, you took them on board, and now any positive suggestion I give you, you're going to be able to take on board and make positive change with. The key to that technique, it's a very clever technique, is that you normalise the arms afterwards, because otherwise when they leave the room they want to do this for the rest of the day.
That's what I was going to say, you know, maybe leaving the room with this.
Tell them that they both feel fine and comfortable and normal.
Okay, great. And that's really amazing, because that can put people's mind at rest, that, you know, that they can accept positive suggestions. And I think the state of hypnosis is the best state to accept those positive suggestions. So do we actually formally have to induce hypnosis, or is there any time during the day that where people can go in and out of this state even on their own, or do some self-hypnosis for themselves?
That's a really, really good question, and thank you for bringing that up. So a lot of people think that they can't be hypnotized or they've never been hypnotized before. Actually, we are all in hypnosis at least twice a day, and we call these our power states, because actually it's a really powerful state where if you give yourself positive suggestions, you are in these states, you are talking directly to your subconscious mind. And those states are, it's that kind of daydreamy state just before you fall asleep at night. So you're closing your eyes, you're in bed or whatever, and just before you fall asleep, when you're just drifting off, you're in hypnosis. And also first thing in the morning, so maybe the alarm's gone, you've pressed snooze, you're still kind of in that daydreamy, snoozy state. Again, that's hypnosis. So anyone can do this. If you can start to recognize when you're in those states and give yourself lots of positive suggestions, it might be in the morning, today's going to be a great day, or the interview today is going to be fantastic, I am confident, I am successful, whatever it is that you want, give yourself within those states, and you're talking directly to your subconscious mind. It does take a bit of practice to recognize when you're in them and use them, but like with anything, habits form after about 21 days. So if you can keep doing that, it will form a habit, a neurological pathway in your brain. And as I said, you will be creating positive change for yourself, because you will be giving those positive affirmations to your subconscious.
That's very interesting that you mentioned this, because I was working with somebody about a week, 10 days ago. And the gentleman is very logical, very analytical. And, you know, according to him, his mind is quite hyperactive. And he makes all his, decisions or analysis or creative work in that power state, which now, you know, we understand as the power state. But he doesn't go into hypnosis so much, but probably, you know, I think that is his state of hypnosis, where he's able to then make those changes and bring out that creativity in him to be able to do the work that he wants to do. You know, so I think that's a very interesting thing. So if people don't feel that they have gone in hypnosis during the session, but they are still able to accept positive suggestions, right?
Absolutely. I mean, even I say to my clients, even consciously. So I was working with a client who had lots of anxiety going on, but also a fear of driving. And so I don't do very many home visits, but because she was concerned about driving, she was struggling to get to me. She couldn't drive on the motorways. So I did see her in her home. And I said to her, even if you're struggling to recognize those power states, if you write your positive affirmations on, I don't know, post-its and put them around a mirror or something, even just looking at them consciously, you will still start going in and you'll start creating positive change for yourself. And it was brilliant because the next time I went to her house for a session the following week, and I had to pop upstairs and use her bathroom, all around her bathroom mirror were these wonderful positive affirmations. I was like, yes, you're doing what I'm asking you to do. That's marvelous. So yes, absolutely, we can create change for ourselves, even consciously, is wonderful.
Yeah, so it's important for the client to have the buy-in into the process, right? And the willingness and the commitment to be able to reach a certain outcome. So it's mainly outcome driven, but the client it's like a two-way kind of partnership, right? It's like a partnership where you reach a agreed outcome, but you're kind of helping each other in that journey.
Absolutely, and that's really key and critical actually, is that it is a two-way thing, in the sense that if the client isn't fully motivated or committed to want their positive outcomes, then you can be the best hypnotherapist, NLP practitioner in the world, but if there's some level of resistance, then obviously it's going to be more difficult for that client. So I always say to my clients as well, it's almost a two-way commitment, whereby I'll give them things to take away to practice in between sessions, so that they are continuing their work in between the sessions. And there's kind of an expectation really from my behalf that they do those things, because they're going to obviously have better results if they do them. And it absolutely, it is dependent on the client's commitment as well. Having said that, there are some very clever techniques, or one in particular, parts therapy, that you could do in hypnotherapy and NLP technique parts therapy, where sometimes there are different parts of us where, for example, I did this one recently with a lady. A part of her wanted to get rid of the anxiety because obviously it was having a negative impact on her life, but a part of her didn't want to get rid of it. And so what we did in hypnotherapy was we identified what the positive intention was behind the part that didn't want to lose the anxiety, and for her it was actually protection. So by creating this anxiety, that part of her was serving to protect her and keep her safe, because she wasn't doing the things that she perhaps would be able to do without the anxiety. So what you then do with this particular session is you kind of integrate those parts and create a super part. It's really powerful. So sometimes there is a level of resistance, which isn't about the client not being committed. It's just actually there's some other stuff going on, or perhaps they're getting a secondary gain from the behavior that they're engaging in, that they've come to see you for.
So people who are kind of struggling with internal conflicts, that I want to do this, but I can't do this, hypnotherapy can be really effective in those situations.
Absolutely. It's absolutely brilliant for them. And it's based on the premise. So in the NLP world, we try to live our lives by a set of what's called presuppositions. One of those is that, kind of their positive affirmations, really, empowering beliefs. And one of those is that there is a positive intention behind every behavior, otherwise we wouldn't do it. So with some of the clients that come to me who've got addictions, perhaps they're engaging in some kind of addiction or behavior that they don't want, or a habit that they don't want. It's about so what's the positive intention behind that behavior?
Yeah.
And once you start to kind of embrace and understand that, it sort of spikes that sort of guilt shame cycle that people can get stuck in around. Oh, I feel really guilty that I'm engaging in this perhaps addiction, or I'm engaging in this bad habit. But actually, that, because I feel guilty, that makes me want to do it even more, because perhaps the positive intention is that at the time it either blocks my emotions or it makes me feel better at the time about myself. So if it's, binge eating or drinking alcohol, whatever that behavior is, but then obviously that perpetuates the guilt, so they kind of get stuck in this cycle.
Yes.
But if we can understand what the positive intention is behind that behavior, it actually kind of puts a spike in that cycle, if that makes sense. It sort of breaks that spike, that cycle, and enables clients to understand what the reasons that they're doing it. So they don't need to feel guilty. There's a reason, and then we can what's the word I want? Install kind of new pathways in the brain, new behaviors, new programs.
Yeah, so it's really effective in that. But, I feel that there is limited knowledge on understanding that, okay, this is a tool that hypnotherapy is a tool that people can use to deal with negative emotions. But that recognition of, yes, I have a negative emotion or a negative state of mind that I need to deal with, I think that's missing, or that's kind of limited, that for people to recognize that there is something that they need to deal with in the first place and then look for the therapy. So I think,
Yes, absolutely. Well, I think also as human beings, we can be our own worst critic. So, and not invest in ourselves enough. So, I do this, and I'm a bad person, and it's all my fault. And this is kind of that conscious, critical mind going on. I remember one of my clients came to me. He was having panic attacks and anxiety, and he had this kind of conscious, kind of cognitive thinking cycle going around that, why can't I shift this anxiety? Why can't I shift these panic attacks? It's all my fault. I must be a weak person. I'm a failure. All this kind of negative thinking going on for him. Bless him, wonderful man. And actually, during the course of the sessions, one of the sessions I did was what we call regression in a child and Gestalt. There's some advanced techniques. So I asked his subconscious mind, I set what we call his ID motor response. So this sounds bonkers, but I get someone to focus. I did a couple yesterday actually. Get someone to pay attention to their hands, and particularly a finger, and then I get that finger raised, and I ask the subconscious mind to take over their finger, and I ask the subconscious mind some questions. If the answer to my question is yes, I want that finger to twitch so I can clearly see. If the answer to my question is no, I want that finger to stay still and comfortable in the air. So with him, we raised his ID motor response, or IMR, and I asked his subconscious mind, is there an event that this chap needs to see in order to resolve this problem with his anxiety, his panic attacks? His subconscious mind said yes. So then we took him to that event. We always install a safe place first because we don't know what that event's going to be. And his subconscious mind takes him where he needs to go. I don't direct or lead that. That's really important. I facilitate the process, but his subconscious mind takes him. And he actually went back to the age of being 5 when an event happened that just started his kind of not good enough program that he was running.
yes.
And then we did lots of healing work around that event. And it completely kind of pulled that root cause. So that's another one thing that hypnotherapy is wonderful for, is getting to the root cause of problems. We healed his little boy. It was beautiful, actually. Healed the little 5-year-old, and I think he had one more session with me, and that was, I think in total he had 6 sessions. And the last time I heard from him, he sent me a text message. He had a session booked in, and he said, actually, I don't need you anymore. I'm brilliant. So I thought, wow, I've lost a client, but brilliant. Really
but you actually, actually, we do make a difference through hypnotherapy. I think because it's transformational, people do see quite transformational results, and they don't need to come back. So I think the most amazing thing about NLP, life coaching, and hypnotherapy, that it just brings around the transformational results that people are looking for, and it's not a long, painstaking process where they don't see results and they're continuously coming in for sessions, talking about it, going out, and not seeing any results. So because it's working at both the conscious and unconscious level of the mind, and using the power of their own mind to drive those positive behaviors and changes, that they start seeing results very, very quickly.
Absolutely. And I think 2 key things to that. We are rapid transformational change, but I think also it definitely needs the client buy-in. Generally, I would say average, it's about 6 sessions, but obviously can take longer. And there are some misconceptions that we perform miracles. Miracles happen, and we facilitate that process. But actually, it's the subconscious mind that performs those miracles. It's a wonderful thing, the mind. It's so powerful. And there was one thing, I know we call this the myths and miracles of the mind. There was one in particular that I wanted to talk about quickly. I train hypnotherapy, and I was delivering to a group. I think we had 12 students in that particular group. And I actually did a group hypnosis session where I hypnotized them all in one go. It's absolutely brilliant. And so they were all in hypnosis. And what I did first was I got a positive affirmation from each of them, checked that they were all happy. But actually, also the subconscious mind will not accept anything it doesn't want. So if I'd put out a positive affirmation for someone and they didn't want that, the subconscious mind would just not take it, it would delete it. Marvelous thing about subconscious mind, it knows how to fix us. So with this one particular lady, I checked with her that I could use this. She had I am safe. That was her positive affirmation. So we did the group hypnosis. I awakened them all. As she's coming around, she was sort of laid there and she started to go, and she was looking at her wrist like this. So we go, what? And she said, unbeknown to me, all I knew was that she had this positive affirmation safe. Unbeknown to me, a few years prior, she had been in an accident and she actually had a metal plate in his wrist.
Oh.
And it still had a metal plate in his wrist. But also with this wrist, she had had a couple of traumatic incidents had happened that were associated with this wrist, a couple of other traumatic incidents. Now, unbeknown to me, those traumas were stuck in her subconscious mind. So simply by that one hypnosis session with that one positive affirmation, I am safe, it removed the psychological trauma, because unsafe was kind of associated with this. It removed that, and she could move her wrist more than she had been able to in years. It was remarkable. And she practices Reiki, so she was like, that is amazing, you've just given me all this movement. One hypnosis session. And it's beautiful actually, because I think she put a review on my Facebook page saying, thank you so much, you gave me back my jazz hands. So whenever she sees me, she's like, jazz hands. But miracle, it was wonderful.
No, I'm sure. And just seeing these results, I think as therapists, it makes us, feel proud of ourselves and to be able to help other people around this. It is just so amazing. And this is such a beautiful example that you've just shared. And I think it can bring around miracles. We don't cause those miracles. People do it themselves. We just facilitate that through a guided scientific process, so to help them do that. But it's all people themselves, their hidden strengths that they're not aware of, their, the power of their mind that they're not aware of. It's just a process of utilizing that, empowering them, so then they can make those changes without actually consciously being involved in that process, because sometimes consciously it doesn't really work that effectively, what your subconscious mind can do for you.
Yeah, absolutely. If so we can say to ourselves all day long, I am confident, I am confident, I am confident, and we can say that at a conscious level, and it will promote some positive change. But actually, if in our subconscious mind we've got a belief, I'm not confident or I'm a failure, that the subconscious mind drives the conscious thinking. So actually often we need to shift things at a subconscious level. And just quickly to say as well, we are becoming more recognised as hypnotherapists within the medical world, and obviously the medical world very much has a place. But just to add with another quick example is that I worked with a guy. He came to me with interstitial cystitis, which is a prolonged bladder condition. And I did 3 sessions. He'd had it for 6 years, and his last option medically was that he had to have Botox injections in his bladder and had a catheter fitted, and he didn't want to do that, so he came to me to see if I could help. We did 3 sessions, and one I taught him self-hypnosis, so it's 4 sessions in total, and I gave him an audio recording, and he was pretty much better. He had a new life. He said, my life no longer revolves around thinking where the toilet is. So it's like 6 years of medical intervention, but because there was actually nothing physically wrong with him, it was psychological. We pulled it and we shifted it in 3 hypno sessions and an audio recording. It's just so powerful.
Yeah, that's very interesting. Again, that the physical symptoms that we see 90% of the time are from the psychological issues that we overlook. So it's sometimes so simple just to address those psychological issues, and the other physical symptoms people have, like headaches and dizziness and breathlessness and anxiety attacks. They're all linked to a psychological state of mind, which through hypnotherapy or through NLP or through life coaching can be addressed to bring around positive changes in a very, very short span of time.
Absolutely. And just to add key to that, so if I had someone who came to me with headaches, I would always check, or a physical condition, I would always check that they have sought medical advice, because obviously we can help people manage pain, but what we don't want to be removing So, for example, if someone had a brain tumor, we don't want to be removing pain from their head in hypnosis if actually there's a physical cause. So just to add that any kind of physical conditions that we work with, we always check that they have sought medical advice and there's no physical cause, and then we can address things psychologically. And like you said, Sabahat, there are so many things where there's a psychological cause at the root of it that we can help with.
Yeah, because I was actually going to work with a cancer patient a few weeks ago, and we decided not to do that because I think ethically it wasn't correct to do that, because he, at that point in time, he needed that medical help that he needed. And then, so we decided to kind of give it a while before we actually start working on the healing process. But, where medical interventions are needed, they are needed. But where they
Absolutely.
can be supported through psychological or emotional help, that's where we can come in.
Absolutely, I couldn't agree more.
So thank you so much for sharing those examples, Bobby. They're just amazing. But just to kind of end, there are, we were going to talk about some myths around life coaching, around hypnotherapy. And one of the ones that I've come across is that people who do hypnosis have magical powers. Probably that's from the stage hypnosis that people see. So just for the people who are listening to this, do we have magical powers?
If I had magical powers, I would bring to mind the national lottery numbers and be a millionairess right now, multi-millionairess. No, we don't have magical powers. And actually, hypnosis, as I said, is a very natural state. Everyone goes into it at least twice a day. We are trained, obviously, to facilitate, to harness, and to use those natural states that people go into. It has been studied scientifically, hypnosis, and it goes back, it even goes back to the Egyptian times. It's been around for a long, long time. We've just got a much better understanding of it now. Because even psychologists such as Freud, Carl Jung, and more recently, Milton Erickson have all studied hypnotherapy. So it actually has a scientific base, and we are changing things within the brain in terms of those neurological pathways. But no, we're certainly not magicians or anything like that.
And just to add to this, it is regulated by recognized bodies. It is accredited, and it has a professional code of conduct associated with that. So it is about the trust, the rapport, the confidentiality. So there is an element of that, which I think gives it a nice framework to operate in and to establish the credibility of the whole process.
Absolutely. Any good hypnotherapist, NLP practitioner should be affiliated with one or more professional bodies and should abide by their code of ethics. And that's right to do so.
Okay. So have you come across any other myths that you would like to share with everybody before we end the session?
I think I covered a couple. One common myth, and this does go to stage hypnosis, often people ask me whether I'm going to turn them into a chicken. And I say, only if you really want me to. So there is a myth that we're going to make people do stupid things. Mm-hmm. That is very stage, and actually people who go up on stage are willing within that environment. They want to be there. And there's also kind of myths about how we can kind of control someone's mind, but actually no one can control your mind unless you let them. And as I said, the subconscious mind won't accept anything that it's not happy with. And we very much work on the basis that, and it already kind of briefly came up, every client has all of the skills, knowledge and resources within them to fix themselves. We just facilitate that process. Mm-hmm. So yes, if you want me to turn you into a chicken, though, I will do.
I definitely don't want you to do that to me. And somebody also said to me that I may be considered weak if I get into a hypnotic state.
It's interesting, isn't it? As I said, we all go, it's a very natural state. We all go into hypnosis twice a day anyway. I think that there is an element where people can feel more vulnerable, of course, and there are a couple of things that we can, as hypnotherapists, can do about that. So my clients are generally reclined. When we're reclined, this area can feel quite exposed. So I always offer my clients a blanket. But so I'm working with that client's subconscious mind, and their subconscious mind, the biggest thing, or one of the greatest things that the subconscious mind is there for, is to protect us and to keep us alive, survival. So their subconscious mind is going to protect them and will not do or allow anything that it doesn't want for them. So actually, they've got their greatest ally on their side in terms of strength, which is their subconscious mind. So absolutely no. I can understand why people feel vulnerable. We can do things about that, but it's certainly not a weakness.
Great. So thank you so much, Bobby, for all this information. I think, I've had so many good experiences with hypnotherapy. I used it for virtual gastric banding, which is another advanced technique of using kind of going through the gastric banding process by using the power of your mind. And through hypnosis, the client feels that they have actually gone through the surgical procedure, which they would have otherwise paid so much money for. And there's so many side effects to the whole surgical process. So all of that gets eliminated and there are no side effects, nothing. And it has been so successful that I was absolutely amazed with the effectiveness of hypnotherapy. It has
You've
worked.
had some fantastic results with clients.
Yeah.
It's brilliant, isn't
I
it?
think it's
And when you get that client feedback and when you can see the benefits that clients are having from hypnotherapy, it's just wonderful as a practitioner. It just makes it all worthwhile. It reminds you why you do what you do.
Absolutely. I think it just brings meaning and purpose to everything that we do as practitioners.
Absolutely.
So thank you so much, Bobby, for your time.
Thank you for inviting me.
We're not able to do the Insta Live, but we'll try and do that very soon so we can capture a lot. But I will be hopefully putting this up on IGTV. So fingers crossed.
All right. Thanks ever so much, Sabahat.
Thank you so much, Bobby. Thank you so much for joining.
Thank you. Bye-bye.
Take care. Bye-bye. Bye.